So I have a couple questions, and just real quickly, and I know we're probably going to be leaving for the floor shortly, but first of all, last week, and since we read it in the paper, it must be true, the Associated Press reported at least 50 data mining companies are allowed to perch on the Healthcare.gov website and access personal information entered by millions of Americans who come to this website for health insurance. And as you know, these data mining companies scour the internet constantly for all kinds of information about us. Without permission or consent from those who are being spied on, they sell that information to any number of people. So perhaps Dr. Romine and Ms. McGuire, first Dr. Romine, does the NIST cybersecurity framework contemplate that a federal agency would be certified and then allow scores of data mining companies to set up shop at a website like that and collect sensitive information?
It's certainly not, doesn't address that very specific issue. What it does address, however, is privacy considerations in a more general context. And I think one of the things that the framework spells out is the need for companies who are setting up cybersecurity risk management structures within their company, whether it's a 10-person company or whether it's a multi-billion-dollar multinational corporation, that they have to ensure that privacy considerations are taken into account, and there are guidelines for how to do that. So I don't have any remark to make on the specific issues in this case, but in general, the framework does have a pretty strong statement to say about privacy. And NIST has embarked on a privacy engineering research activity, partly as a result of what we learned from the framework process, that there needs to be more guidance and more tools available for people to promote privacy considerations.
And Ms. McGuire, if you could comment on the presence of so many of those data mining companies and whether or not that makes the website more vulnerable to attacks.
So I can't obviously speak to the specifics of the technology of what has been being used, as I'm not intimately familiar with the Healthcare.gov website. I do find it surprising, though, that there are that many additive websites or technologies that are able to access the data. Certainly opening up the network, that would indicate that it would provide some additional vulnerability, but I don't know all the specifics.
Okay,
so.
fair enough. Yeah.